any additions or changes to the agenda? Otherwise, then to get a motion to approve.
So move.
Okay,
I'll
a
second it.
Okay, second by Julie. All in favor, say aye.
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 Okay. I gotta move closer to my other computer here. Next, approval of minutes. Did anybody see anything that needed a change on the minutes? Otherwise, we could get a motion to approve.
I'll motion.
Okay, Dr. Heim, any second?
I'll second the minutes.
Okay, second by Julie. All right, all in favor, say aye.
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 All right, set our date, our next meeting.
So November, it would be probably not the 5th, that's too early in the month to get like reports out, but the 12th or the 19th would be the two other Thursdays, because the 26th would be Thanksgiving.
I guess my vote would be the 12th, unless anybody has a conflict.
The 12th works for me.
Works for me.
It works for me.
Oh, hello. Okay, well then, should we go
Works for
with
me too.
that? And my guess is, obviously, we can set the mode a couple weeks before. I'd kind of be shocked if we weren't still Zoom, but hey, you never know. Maybe we'll be back to in person. So should we go ahead and set that then, November 12th?
Sounds good.
Sounds good to me.
All right.
Fine.
Moving along then, Paula, you're up. Program updates.
Okay, I just had a couple updates. I wanted to just kind of, we had our children's health clinic in August, and this year we did that by appointment only, and it worked. We did okay, I guess. It was a bit challenging to change. We kind of felt like we had mastered it under our old system, but and so we were able to see a total of 67 children, and that was from 41 families. So pretty comparable, I think, with over the years of the numbers that we've seen. And the services provided at the clinic were the physicals. We did dental screens, vision screens, local public health. Carroll Public Health was here for immunizations. We did lead screening, and then developmental screens. This year, the only thing we didn't do was the haircuts. That's always challenging for us to begin with, and we just thought with COVID, that was just one thing that we weren't going to try to accomplish this year. So the one thing that was probably different for us this year is we actually had 3 high leads out of the 13 kiddos that we screened, and one of them was as high as 29.9. So that was a first for us to have 3 high leads come out of that clinic, but so we are following up on 3 of those. Average age we saw was, again, that preschool kindergarten, which is really why we provide the service. It's strictly a gap filling service, which is why we hold it so late in August. We do prefer that they go to their primary care provider, get their physical immunizations and all that. But I think I've mentioned we've started this several years ago. I think it's been 5 or 6 now. And just as that gap filling service, because the clinics do get busy, because everybody kind of waits the last minute to schedule all their appointments. And so a lot of our families, needed to get in before school started, especially with some immunization issues this year. So, and then the only, just an update for WIC, we're still operating under the waiver. So services are still being provided by phone only. That waiver is still in effect until September 30th. There is a push at the federal level and for USDA to grant an extension of that waiver. It is included in the HEROES Act currently right now, and if any of you are following, there's not been any movement with any of that. That includes all the stimulus and everything in that HEROES Act. So I don't foresee them working to compromise. So our option will be that hopefully USDA will step in and maybe make some exceptions to policy as far as waiving that physical presence at WIC. So I will definitely keep everybody updated. I do try to keep local public health and our community service providers in the loop on when we'll anticipate being back providing services, at least in person. The only other thing I wanted to mention is just we're still providing our Title X family planning clinic services. We offer that clinic once a month. We have seen a little bit of uptake in gonorrhea cases in Carroll County specifically. So we have been a little bit busy doing some STD screenings for gonorrhea. So not great news on that front, but I think across the state we're seeing a little bit increase in that too. Usually, you know, most of ours is generally speaking chlamydia, but we have seen that change in the last month. So any questions?
Paula, you said you had 3 lead in children.
Yep.
Any reason why? And then you said one was pretty high. How high was it?
Yeah, 29.9. And that family had actually moved into a rental property. And the landlord did disclose to them that it was known to have lead. But I think mom probably didn't really comprehend what that meant. I don't think at all for her child. And on top of that, this kiddo is a thumb sucker. So I think it was just kind of a double whammy for this kiddo. We've had huge barriers getting them in for follow-up. They experienced a house fire here in Carroll that was intentionally set. And then mom experienced some vandalism to her car that was done over the weekend. So we're working closely. It happens to be also a Head Start kiddo, so we do have good access to mom. But they are out of the house, which is a good thing. Bad how it kind of happened for them. But it hopefully they do have secured a new place to live, but they're not available until the middle of this month. So hopefully we'll see that lead come back down, but it always takes about 6 times longer to come down than how fast it went up. So
Okay, so it was due to lead paint then.
yeah.
They knew about. Okay.
Yeah.
So as long as a landlord just discloses that there's lead, they don't have to remediate or take care of it?
Technically, they are not supposed to rent to a family that has children. So he should not have rented to them in this situation whatsoever. It's unfortunate because I think mom just did not comprehend what that meant for her kids. And there is an older sibling, just like a year older. We went ahead and tested him, even though he wasn't within the age guidelines, and he was fine. But I just think because this littler one is sucking his thumb, it just exposes him to everything. So.
Any repercussions on the renter? I mean, does that person have other properties that other people might be exposed that might have lead?
You know, I will follow up on that. I will find out.
Was the house that burned, was that the house that had the lead?
Mhm. Yeah.
So are they going to repair it, or what are they going to do?
You know, I don't know, because I mean, a lot of it was located in the garage, but I do know, like, as far as inside the house, you know, just the water damage was pretty extensive. So I haven't heard if they totaled it or what they did with it.
Paula, that lady is an RN. That
What?
owns that house. The lady who owns that house is an RN.
Really?
Yes. She works at Regency. And she's a bus
Interesting.
driver or special ed at the school.
Interesting. Yeah. You hate to see a kiddo with that high lead.
Well, the main thing would be if there's other properties, you don't want anybody else to be in that situation either. So.
Yeah.
Okay, any other questions for Paula? I just have one question, Paula.
Yep.
You have those beautiful blue glasses. Why
Yeah.
aren't you wearing that sparkly blue dress behind you?
My Elsa dress, I keep telling everybody I've got to get rid of that because everybody's always like, what is that dress? Is it a prom dress? I'm like, it's our Elsa dress. I would not fit in it, Becky.
Next meeting, maybe. All right, moving on, Carrie.
Oh, I sent monthly reports for July and August this morning. I'm sorry I didn't get them to you sooner. I have no good excuse, so I'm going to blame COVID. So did everybody get it? If not, I will resend it to you. I sent two actually. The first one didn't have any of the attachments and the second one did. So you should have 2 emails for me. That's really all I have. I mean, our office is just continuing on with whatever we get called about. Passports are still up in the air. We reached out to the U.S. Department of State, and they are still telling people to expect significant delays. There must be some passport agencies that still have not yet opened. So they're still working on catching up from over the shutdown, and they're still telling us to tell people significant delays. So that's what we're doing. Other than that, we are, just doing what we normally do. So if you have any questions about the monthly reports, if you have them now, I'll address them. If you have them later, email me, call me, and I will go over them.
So you still have passport numbers. You mean you process them, but they don't get approved? Is that the deal, or?
No, we're still we're taking the applications here, and then we send them to Texas, where most of ours are going to Texas. So it's when they get to the U.S. Department of State facilities, that's where the delay is. The delay is they're trying to catch up on all of the applications they received while everything was shut down, including them. And then they're still receiving thousands of applications from places like us. So they're just trying to catch up.
So what does a person do in the meantime if they need the passport?
Well, right now, need is based off of illness and death. A lot of the countries don't want us now anyway. So the only people who are getting passports sooner are those who can show that there's a family illness or death that would require them to leave sooner.
Okay.
I'm just interested by the fleas on a business patron.
Yes, I got a call that in a community in Carroll County, there's a lady who has cats, and the cats are flea infested. The house is flea infested, and she's been visiting local businesses with fleas on her person, and they wanted to know how to deal with that. I don't have any enforcement authority, but as a private business, they can say, they can keep her out until she does something about her flea problem. She can live with fleas all she wants, but that doesn't mean she's got the right to bring it into a public place. So that kind of falls back on the individual businesses and what they're willing to tolerate or not. I never hear follow-ups. They call me, but they never call me and say, this is what we did, this is how we addressed it, and this is how it went. So I can't give you a follow-up, just they called looking for advice.
Okay. Anybody else have any questions for Carrie? All right, then we can keep moving on. Megan.
All right, I sent my reports through email, and then any questions on those, I guess, before I. Or if you come up with anything. The only other thing was just kind of was gonna update, I got those iPads ordered, they got them. The program for this electronic documentation has been released, so we've been working with that, and hopefully middle of October we'll be starting with that. They wanna do trials, so that way we know January 1 it's good to go. So so far everything's going good with that, and that's really all I've got.
Any issues with the COVID-19 and entering homes and that type of thing, Megan?
We haven't had any. Early on, we had a couple client issues. Here lately, we haven't had a lot of client issues, but we do have an aid out now for quarantine. So we are down an aid, I guess, due to the COVID. But otherwise, so far, so good. Hopefully it stays that way.
Okay. Anybody else? Anything? Then let's move on to public health nursing.
Hey guys, so Carrie, I'm kind of in the same boat as you. I completely forgot to send my stats and financials off. So Megan, I had her send that this morning. So hopefully everybody received them in your email. Just an update on financials here real quick. So we had received about $6,700 for COVID relief, basically from the state. And we're kind of looking into it to see, you know, should we be using the money more for COVID, like vaccines, supplies, salary? It was broken down. $5,200 did go to salary, and $1,500 went to other, which would be needles, wipes, sharps, containers that we're going to need for any COVID clinics that we do. For the 6-year plan, we also got some extra money. We got $11,418. For the salary part of it, we had $6,425, which about $500 is left on that. And for the supply end on that 6-year plan money, we did receive a total of $4,993 for supplies. We have used about $300 on that. So we do have $4,693 left to spend for whatever we're going to need, whether we need to set pods up. We're still trying to figure out when we start getting COVID vaccine in, which one are we getting? There's one that the cold storage chain, it's -70 to -80 degrees. So we're going to be looking at needing dry ice because we don't even have freezers that go that cold. The other one, it's the normal ones that we keep our MMR and varicella vaccines in, so that wouldn't be a problem. So that's something we'll probably look into for that to kind of spend that kind of money. If you look at our stats, our foot clinic, they've been doing good. We've been going to all the assisted livings, the rec center. People are coming out and about again. They're very thankful when we are there because a lot of poor feet need some help. Blood pressure clinics, we're not quite up to where we were before COVID. There's just not a lot of people that are at the places we go, such as Hy-Vee at their marketplace where we would go. So we're just kind of waiting until it starts picking up again to get out and do blood pressure clinics. So that's kind of what I have for that. Does anybody have questions on the grants or anything for the financial stats I gave?
You mentioned that some of that vaccine has to be stored at -60 or 70. Is that, I haven't followed that close. Are you talking then it's got to be a modified live vaccine then, right?
You know, I'm not 100% sure. They're just starting to come out and talk about it. I'm not sure on that, doctor. I'd have to double check on that one.
I would almost venture to say that'd have to be a modified live to
Yeah, because we've never had a vaccine that had to be stored that cold before.
Yeah, if it'd be a modified live vaccine, I'd be a little concerned about the public's perception of that.
Okay.
You know, injecting something live into your body is going to be a little more concerning, I think, than something that's killed. So.
And I did just see on the news this morning, they were talking about that too, that vaccine, I don't know if that was AstraZeneca or which one that was, that they feel is the closest along, but that's the drawback. Nobody has the storage that could be at that capacity.
Right. That's why they were talking to keep it in the coolers that we receive it in, but we need to find the dry ice. I don't exactly know where around here who sells dry ice. So if anybody has any tips on that, that would be great.
I think IV would have dry ice.
Yeah, they have dry ice.
Okay.
Or would you be able to use the liquid nitrogen like semen tanks?
I know, someone had mentioned that to me, and I'm like, oh my, that would be real cold that we get it there. So yeah, I'm not sure.
The joy of having show cattle growing up. You had...
Right. Dr. Heim, on that vaccine, have you heard or do you know, are they live or not? I mean, attenuated or?
I have no idea what they're going to end up coming up with.
Okay.
But, you know, when they're alive, they genetically modify those so they don't have the activity that they would.
Well, and that's like
they have to still be able to show the safety profile. I mean,
right.
We want to. The problem with the RNA viruses is they replicate so quickly. So I don't know for sure if that's why they want a live attenuated virus. I don't know.
Right, because isn't like varicella MMR and MMR, aren't they attenuated?
Yes.
Live?
Yep.
So that's why they're frozen. So okay. So that's kind of all I had on that. But if we look at the fiscal year 21 grant approval, I guess I'm just bringing this up here. So it looks like normally the total grant that the county gets is around $55,686, and of that, public health gets 37%, or roughly $20,603, and home care they get 63%, which is roughly $35,082. And I didn't know, we're usually running out of money kind of by the end of the fiscal year, and I didn't know what your thoughts were of maybe doing a 40-60 on that grant instead of a 37-63 split.
We're gonna, just so I can clarify, we were gonna keep it the same this year since it was
correct
done.
Yes.
So just so I have it for the minutes as well, we have to actually approve this year's breakdown, and then we'll have to, you know, the whatever you decide for next fiscal year, just so we know what we're talking about for sure.
Yeah, and honestly, I mean, we'd really have to go back through the minutes to figure out, I can't remember why. That, you know, back in the day, questions like this, we would just say, Marge, tell us again, why is it like that? And she would just have it at the top of her head. So I know I've heard the explanation many times, and it's not clicking with me. But yeah, I don't see an issue with that, as long as, you know, the supervisors wouldn't see an issue, because then that's going to probably increase a little bit of Megan's tax asking. But you've always been so far below your task, you know, what you've asked, that I don't see that it'll be a jump, honestly, when it's all said and done. But just to make sure all of the the budgets are on par for this year with what the expectation was, then yes, I think if we could get a motion to approve the breakdown of the 63% and 37%. Someone wants to do that? Or if there's other questions, if you want to discuss it.
You were just thinking about rounding the numbers up, basically, to 40% and 60%? Is that what we're talking about?
For the next year, yes. Keep it the same as it is this year. Correct.
Yeah, I'd probably hinge on Megan if she's okay with that. And I don't think it makes a big difference to the supervisors. You know, it's not a big number, so.
Yeah, it's just going to increase her tax asking slightly.
Right.
You know, but again, like I said, I can't recall a year ever that home care aides hasn't given back some money to the county, you know. So so we need
things have happened, you know, that crazy things, right, Megan, that have come up where you know, you didn't need all your budget. That is not necessarily the case all the time. It could swing the other way at some time as well.
It's always a shot in the dark as far as what we're going to get for, you know, fees and stuff. I mean, because we can't, you know, I can lose a client tomorrow, you know, we don't know that, but yeah, typically we're fine. So I don't see a problem with the going to the 60-40% for starting fiscal year 22 or 22.
I just had a question for Nikki on the 6-year plan, COVID-19. What does that mean? 6-year plan, COVID-19.
Well, as far as, and Nikki, you can speak up too, but if you know, but as far as I know with these 6-year plans, which isn't a lot because I really never had much training on them. So the state, this was already in place before I got here. There's a 6-year plan for the county. And maybe I should get Beth in here because I think she can actually explain it better. So hold on just a second.
Do you recall, Becky, is this something new?
I've never heard of a 6-year plan.
Yeah, I never heard of it either. I mean, are we getting extra money from the government for the COVID-19? Another grant?
Unless our China HIP, is China HIP being extended? Because that's usually 5 years for public health, 3 years for hospitals.
Okay.
Becky, can you hear me? This is Heather.
Yes.
Yep.
Okay, I might have a little bit of information on that. So this would be the 6-year public health emergency preparedness grant that was already in place. And then when COVID happened, I believe the department maybe got some extra funding. And then because those 6-year contracts were already in place, they just did an amendment to them and added some additional funding for that.
Okay.
So this is something new. Sort of. New
sort
dollars.
of. It's an amendment to a current contract, and I believe they did it that way just so that they wouldn't have to come up with a completely new contract. It was just that was already in place with all 99 counties.
Okay.
Thanks, Heather.
You're welcome.
Thank you.
Okay, any questions? So any other questions for Heather or myself? Okay, so we'll move on to the
wait, we have to get the approval for the grant for the current year.
Yeah, I'll make the motion.
Okay.
to keep it at 37 and 63% for the grant to be split for this year.
Okay, anybody want to second that?
I would second that.
Okay, all in favor, say aye.
Aye.
Okay, and now if we could get another motion to make the change for fiscal year 22 to have the breakdown 60/40. Someone wants to make that motion?
I'll make the motion to change it to 40/60 for the year of 2022
Okay,
for the grant.
and I'll go ahead and second that motion. All in favor, say aye.
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 All right. You can continue, Sarah?
So we'll go into COVID now. Currently, Carroll County, we are sitting at 503 total cases. We have 232 cases recovered. We have 271 active cases currently. Our 2-week positivity rate for Carroll has slightly decreased to 16.5%. And our overall positivity rate kind of has been hovering around this 10.4%. I'm thinking, which I hope this is a good trend, but I'm thinking the reason we see this downward trend of the 2-week positivity rate week coming down is because there wasn't a lot of testing going on Saturday, Sunday, Monday. So we may see that number go up again. We may not. So what we're seeing in percentages for where we're seeing a positivity, right now, the adults age 18 to 40, they are at a 37% group where they are the ones that have the most of it. Kids age 0 to 17, their positive cases by their age group is at 14%. That did go up just a hair. It was 13%. Middle age, 41 to 60, we are sitting at 30%. The older adults, 61 to 80, are at 16%, and the 80 and older, they are sitting at 4%. So we kind of do see a trend where it's the younger adults and children that are having the little bit of an uptick there. Carroll County Public Health, we are no longer doing the case investigations. I think I was looking for more help to do it, but it kind of just got to the point, I guess, that others have just decided that it was a lot for us, yes. So we have turned that over to the state. We still do cases that are school-age kids. We do long-term care facility outbreaks and anyone who tests positive within that facility. And if the state starts seeing a trend of maybe a business that has a lot of cases, they're going to let us know, and we will contact the business to see what's going on, what kind of policies and procedures are in place for them for COVID-related issues, their cleaning, hygiene, stuff like that. So currently that is where Carroll County is sitting for COVID.
I will give you kind of a practical application. We tested when all those tests were coming in. We had tested something like 78 to 80 people, and only one of those came back positive. So we had a huge uptick in testing and not a lot coming back positive for a bit there too.
Oh, perfect. Because I think, I think Test Iowa did 170 in a day and 25 came back positive, something like that.
Yeah. And I think Test Iowa gets a bigger concentration of potential positives because a lot of those people are directed there to test after an exposure. We do all symptomatic patients. So that's out of symptomatic patients.
Okay.
So there's a lot of other viral things going around right now that's making life interesting. But
absolutely.
Yeah. So I would say a majority of what I was seeing, however, over the last week was actually not a ton of COVID.
So maybe we've gone through when I talked to Nick, this was last week, he said that Iowa was the worst state and Carroll County was the worst county. So he goes, I wouldn't be surprised pretty much to see if within the next 2 to 3 weeks, it'll pretty much move on to another county. So we're going to see a decrease in numbers hopefully soon.
So what is our overall number again? 500?
503.
Okay. All right.
How many deaths in Carroll County?
5.
5?
Mm-hmm.
So how has that been working for you, Sarah? How's it been working for public health to have IDPH come in? And are we seeing the same? Are we getting the results the same? Are we getting?
Yeah, we're still we still get notifications. So for me, it was just a little confusing when I had, and Nikki explained this to me, but and I didn't realize it. So basically, IDPH is still going to send. We're still going to get those notifications. But we don't have to do those cases. So the confusing thing I think it gets to is people call us and ask us about isolation, quarantine, things like that, and we don't know anything about the case. So then it kind of, just takes more time to look it up, and then did the state get it done already? Things like that. So it is a little more time consuming, but we've only actually had 4 or 5 cases since the states took it over.
Sarah, the other thing I will say too, the primary care doctors at McFarland can give people all that information too, if you don't feel like you want to, because that's what they're doing. If we find out they're a patient, we give them the option for home monitoring, and they call and they check on them and give them all that information. They do all their return to work stuff and things like that too. So that's still an option to kind of upload some of that as well.
Right, and we kind of stopped, at public health, we used to call them almost every day. And then we decided that since the providers are calling them multiple times, there's no use of us calling them all the time. So we actually only call them pretty much the initial interview that we did with them. And then when it got a little closer to releasing them from their isolation. So yeah, it was just, and people were getting called multiple times, and it was getting annoying to them. So we just said, no, we won't do that anymore.
Dr. Heim, this is Nikki. My fear is, how are you guys going to know all the positives? Because Sarah and I were calling positives to Sue or Missy or to urgent care every day at the end of the day. And they weren't aware of a lot of them because a lot of them do come from Test Iowa. And I don't know that the state will notify docs.
No, we haven't gotten any. All the ones we get are self-reported. So I'm saying, do you guys get the names of the people, or do you just get the case number? Like, we had 5 today, or do you get Susie Q and Jimmy John? They were positive.
Yes, we get the names, but it doesn't
We
have
get
a doctor in there because they've been tested.
I can't hear you.
We get the names, but we don't get the doctors because they're all under Dr. Padati when they go through Test Iowa. So we don't know who their primary is without calling them.
Sure. Yeah, I mean, aside from the patient calling, because I mean, a lot of the people we get reported to us first, and then you guys call, but sometimes you guys call first. So it really, I mean, you probably don't need to give us all those names because most of those aren't our patients, and we probably shouldn't know about it. So it's a HIPAA violation. But yeah,
well, we only give you your McFarland patients.
Yeah, I know. But what I'm saying is if you call us and you don't know whose patients they are, you can't just give us a whole list and let us weed through and figure out who they are. So
I just hope they don't get lost in the system.
Yeah, and to be fair, I mean, I feel like, and not to rag on Test Iowa because they do a huge service, but they don't give them any education. those patients 9 times out of 10 are the ones that get their tests and then go all over town for the next 2 days while they're waiting for their test results because nobody told them they needed to quarantine. So that's the one downside to have these people floating in the breeze, is that nobody's holding them accountable to staying home. So, I mean, I don't know if there is a process that we can implement that, and I don't think you probably want to call all those people, but most of them call us and let us know, but not all of them.
Yeah, I think we do need to find some sort of a process, especially keeping people home, because we know of people who've come out of McFarland and Test Iowa and St. Anthony Clinic and Manning Hospital. Oh, I didn't realize I had to stay home for the last 2 days. Really? Like, come on, yes you do, because they told you. It's in the paperwork. They tell
Yeah.
you, and I mean, I know education is being done by all parties, and I just think literally people will do what they want to do. And we can tell them, please stay home until you get your test results. Here's information that you need to read over. It says it again, please stay home. But they don't. They're like, oh, I was out, so I went to the grocery store. And then I had to go pick up a pair of shoes for my daughter. And, oh, and then I decided I'm going to go around Small Lake and talk to my friends out there or whatever, whatnot. So I
Yeah,
just think people are sometimes.
yeah, but we keep track of every person we swab, and then we call them back with all their results. So we know
Right.
every single person that we've seen. So we give them all the communication about what they should and shouldn't do after they've been tested. But once they go through Test Iowa, what they do with their result is kind of on them.
Yeah, I thought Test Iowa, if it's a positive result, they send an email to them and call them. And if it's a negative, they just get an email. Maybe I'm wrong. I'm not sure. Nikki, do you know for sure?
I'm sorry, Sarah, someone was in my office. What was the question?
Dr. Heim was saying how they have a really good system of making sure that they're contacting all their patients and they know every patient who they swab and test and call and everything. And I was wondering with Test Iowa, they call all positives and send an email to, right? And then if they're negative, they just do the email?
Test Iowa itself sends that email, correct? Yes. And then if they're positive, the EOC calls them directly to make sure that they got that positive email.
Okay. Yeah, it sounds like McFarland, you guys have a good system out there.
Yeah, but we're not testing, 200 people a day either. So, I mean, I get it, but it's kind of like, if they kind of disappear after they've been contacted, they're, I mean, yeah, you've been told you're positive, but if nobody's watching that person, I mean, even people that we're watching will walk into the front door of the clinic with a positive COVID and no mask on. And it's like, what are you doing?
Exactly. Yeah.
But then they come in because they're like, well, I still have a cough. And then they're like, well, can I go back to work? No, you cannot. Like,
right.
So that's what I'm saying. That's even with doctors calling people. When people don't have someone that's plugged in to kind of monitor them, they're free to just go rogue, I suppose. Which I'm sure the state is trying to keep a hold of them, but.
Right, and that's where when we would do our case investigations with them, because it might be a day or two after they get the positive result, and then we got notification from the state through IDES saying, hey, Johnny is positive or whatever, and then we'll do that case investigation and remind them, hey, please don't go anywhere. It's recommended that you stay home, yada, yada, yada. And then that's when we would get their PCP and be calling the PCPs and let them know. And hopefully then that patient would be held more accountable. But now that we're not doing those investigations, you're right, people at Test Iowa, they could be spreading it all over and we don't know.
Yeah, that's the hard part, is the tracking them after they're done.
Right. Exactly.
So that's not part of the investigation? They don't ask the primary care provider?
There's a box on there that we mark has primary care provider been notified. So I don't know if the contact tracers at IDPH are as diligent as we are here and are asking. I don't know. I'd have to look at the few that they've gotten now from us to see how well they're doing their investigation. Because it doesn't have a spot to put in their doctor unless you put it in the notes section of it, of who their PCP is.
So it sounds like, Dr. Heim, you're getting a lot of symptomatic individuals. What about the hospital? Are you getting symptomatic, or are you getting Test Iowa?
Test Iowa would probably be, I don't know 100%, but they would be getting a little bit of everybody. The asymptomatic ones, the ones that were exposed, because we do recommend when we did the investigations that if they were exposed, they should test 5 to 7 days after initial exposure, because we're trying to catch the asymptomatic ones that are running around spreading it. And if they have symptoms, we're asking them to test 1 to 2 days after symptom onset. So Test Iowa, I always give them the option, Test Iowa or their PCP. But so I think Test Iowa would have more of the exposure asymptomatic ones to symptomatic and exposed symptomatic people.
Yeah, we don't do any just screening at McFarland. That all has to go through Test Iowa.
Well, I did both myself, and they were both completely different the way it was done. And I got you're asking how these individuals are contacted. I was emailed that I was negative with Test Iowa, and I continue to get follow-up emails on how I'm feeling, and even 2 months after I had the test. And with McFarland, I felt I was symptomatic. I was really confused as to whether or not, I should go in, but I went in, and you do screen. You go in to the urgent care, and they do say you are a candidate to be tested. And I was tested, and then 4 days later, I was negative. I don't know what the hell I had. It sure was symptoms that I would consider to be COVID. But I did have my blood drawn here with LifeServe about 2 weeks ago, and nope, I wasn't lucky enough to have any antibodies. So I'm still watching where I'm going.
Yeah, that's what I'm saying. I'm testing a lot of people, but I'm not getting a lot of COVID. So there's a lot of other stuff still circulating around. So.
Are you starting to see flu already?
No influenza yet. Thank God.
Dr. Heim, this is Nikki again. It came up the other day, when influenza season starts, it will be 2 different swabs. Like, have the doctors discussed what their plan is? Are they going to test for influenza? And if that's negative, COVID, or COVID then influenza?
We're hoping that we can have a alternative to different nose swabs, because, just because someone has influenza doesn't mean they don't have COVID. So I don't know that I would swab someone for influenza and say, you don't have COVID. So you're probably going to end up with 2 nose swabs. So we're hoping by the time we get to flu season that we're able to do either all of it on 1 nose swab or a nose swab and saliva. There's going to be a certain point where we treat it similar to the way we treat flu. With influenza, there's a lot of times that I don't even swab people because there's so much influenza that I tell them it's probably influenza. You need to stay home while you're running a fever, ... The problem with COVID is that there's no vaccine. We don't know what the immunity is going to be long-term. But the test that we do for rapid influenza isn't 100%. It's not a PCR test. It's a quick test, but at least give you an idea, what you need to do with that patient as far as keeping them home. So I'm hoping that all these masks are going to keep us from getting flu this year. That's my crossing my fingers. In the Southern Hemisphere, where they normally have influenza right now, the numbers are way down for influenza because of mask use due to COVID-19. So I'm going to just pretend like flu's not going to happen and it's going to be fine. But yeah, we're trying to hopefully we'll get a different swab option so that we don't have to swab two. Right now it's 2 swabs. It's 2 separate swabs. So if you get swabbed for influenza and RSV, then you'd have to get a separate swab for COVID.
I just read a report yesterday or the day before that they were working on something for one swab that could test COVID, RSV, and the flu with just the one swab. So I don't know if that's something that will be widely available or if that's just something still in the works, but hopefully.
I mean, we have viral PCRs that can check for all of those things. And I do that occasionally for people that are higher risk for complications of other things. So every once in a while, I'll throw a viral panel swab in there just to see what I've got. But that's $500. I mean, that's just, that's just not, and $500 is the lower end of the cost. I mean, it can be more. So it's just not cost conducive to do that on everybody. But it's a better test in general than our rapid test because it's, a rapid test is using antigens. And so it's not as sensitive and specific as a PCR. But it's a good rapid evaluation because the other thing is those PCRs, those are sent out, you got to get them back later. But yeah, so the other thing is the availability of those tests, once they create them, like there is a saliva test, you just can't get it. Sometimes you can't get the testing stuff. Or at least we can't, but nursing homes can, so they decide who can get them and who can't get them. And sometimes that's the rate limiting factor, unfortunately.
So do you anticipate any kind of confusion going forward? Say if we do have a real big outbreak of flu, that it can be confused with COVID-19? I mean, with trying to determine which is which.
Oh, absolutely. The problem with COVID is it's so similar to other things. I mean, literally every single virus mimics COVID symptoms. I mean, cough, runny nose, congestion. I mean, but when COVID first came and we were isolating, I mean, I had people coming back from all over the country and I'm like, if this person doesn't have COVID, I'll be surprised. And it was metapneumovirus or something else or another coronavirus strain. So, I mean, there's all those other things. And, the treatment is the same, honestly, for all of them. I mean, influenza, we've got Tamiflu, but the COVID complications of COVID are much more severe. And that's what makes that one different. But yeah, absolutely. They look exactly and smell exactly like almost every other virus. So.
Dr.
So are we doing any, I mean, it sure appears to me that we really need to get the word out as far as wearing the mask, that it's, I think Dr. Heim makes a good point that, in the Southern Hemisphere where they wear masks, they have very little flu. And I think that should probably be a PSA of some kind, and get the word out that, even if it's not just COVID-19 now, it's also the flu. And I don't know. It seems to me like we need to be doing a lot of education.
Dean, I was just going to ask Dr. Heim that too, because Dr. Heim, you had mentioned the Southern Hemisphere and their influenza is really down because of masking. Mm-hmm. Now, do you think a mandated mask policy or something for Carroll County would be appropriate? Or do we just keep doing what we're doing, hoping people would listen, saying, hey, look at the Southern Hemisphere, their influenza cases are down and COVID is, I don't know if COVID is controlled down there or not, but I don't know what your thoughts are. I mean, I know our 10.4% overall positivity rate for the county. Is that something we should think about? A mandated mask?
So to be clear, I don't think the Southern Hemisphere has all mandated masks. I'm just saying that by wearing masks, And I would never advocate wearing masks to reduce influenza spread because we have a vaccine.
Right.
I have mixed feelings on masks being mandated in general because of how that looks for certain places. I think you can make arguments, you know, the lower risk groups not wearing masks and, you know, their risk of complications from COVID and all those things. And there's going to be a lot of people that aren't necessarily super excited about that. But I wouldn't necessarily use influenza as a reason to, especially now, because we don't get flu usually until December, January, February.
Okay.
I'm just saying that I mean, that's a nice side effect of COVID precautions. But I think we're not really necessarily, I mean, 200 cases, active cases out of 10,000 people is not
a lot.
terribly bad. And that's just in Carroll. That's not the whole county. So I don't know that I'm there yet for thinking that we need a mandate in Carroll County. I mean, it's,
I mean, those numbers
we have a
are
college population that's spreading it all over the place or anything like that.
Yeah. I mean, those numbers are countywide.
Yeah.
Yeah, I guess I don't know. I'm trying to think of stuff to do because our poor nursing homes, they're spending upwards of $7,000 or more a week just on testing their staff, and because of our high percentage rates, because that's what they had to do for CMS. So I don't know, I'm at a loss of PSAs, I guess, as Dean puts it, for
Sarah, the nursing homes have to do that because of our high rates, and then
yes.
if the rate goes down, then they go away from that again?
Yes, then it'll go to weekly instead of twice a week. And then as our numbers keep falling, then they follow an algorithm, and once our numbers fall to a certain point, I don't know what that point is, then they won't have to test like they're doing right now. And they'll be able to open up a little more too.
Well, I know that there's a lot of parents, schools complaining about the number of kids getting quarantined due to, you know, the one positive kid and it sends 60 kids home type thing. So I know that the governor is looking at if they have a mask mandate in schools, so not statewide, but in schools, that to help bring the positivity rates down in these school environments, Iowa State, you know, University of Iowa, etc., then that they're also considering how that would not have so many kids get sent home. Because if both kids are essentially wearing a mask, and you don't have to send 8 kids around that kid home. So I know that they're talking about that right now, because they too are trying to come up with what is the solution to kind of get us out of this slump of the number of things. But we talk about Test Iowa, McFarland Clinic, this, that, everything. I still feel like we're all not on the same page in the county, because hearing everybody talk, there's so many businesses in this county that allows their people to go to Test Iowa, get a negative, and then they can go back to work. But at the school level, you can't go to Test Iowa and get a negative and go back to school. Does that make sense?
Right. Yeah, because if nobody can test out of a quarantine.
Yeah, but employers are letting them. So
and that I agree with you, Sarah. I really think I could hear in your voice, Sarah Schulte, the frustration perhaps of having IDPH take over some contact tracing. If you guys aren't happy with how that's going, if you think it's making it more of a mess, then feel free after testing it out. If you don't think it works, let's revisit and go back. But right now, I really think what a critical function of the county health department is to really be that central message that that unifier, the one that's going out and making sure everybody else is coming in to get on the same page. And with health literacy in general, you have to, and this I feel like I can actually speak not at expert level, but I did a ton of research on health literacy. The majority of people are just very health illiterate. That's why we have the health problems that we have. The doctors can talk to them till they're blue in the face, and they'll nod and say yes and walk out the door and do the exact opposite. So that, I think, is what we're really seeing, why we have so many people in this county that aren't getting it. I don't think it's the contact tracing. I don't think it's the nurse that saw them in urgent care. You know, it's just in general that the only way you combat that is to continually push the same message over and over and over, the repetition. And I feel like right now, there needs to be the same message constantly through Facebook, you know, not just a couple times a week. And I know it feels repetitive, but change the words just slightly, because what people aren't getting right now is that you have to flip and keep your butt home after you get tested until you get the result. I mean, a couple days ago, kids going back to school, coming home telling me stories, I just feel like you want to bang your head against the wall. And I know you guys are in this, you know, you repeat those messages to people constantly. I mean, I know the Test Iowa people, McFarland, the docs, everybody that does the testing, but they're still not comprehending it. So the more that we can, that's, you know, what public health is, the health of the public. It's to reach as many people as you can to protect your vulnerable, to protect the best interest of everybody. So I think that focus, you know, if that is going to mean going to different businesses during the week and just having a quick, okay, just wanted to educate you, you have a high, you know, go out to Farnerbach, you guys have a high number of employees here. Just want to make sure all your managers are on the same page. This is how we can slow the spread. This is what we can do in our community to help keep people safe, to help keep our businesses open. I mean, just you know, throwing that out there to think outside the box a little bit. And I know it's super frustrating. I know those messages have been out there for 5-6 months already. That's just health communication in general. You know, if people would get the message about healthy eating and exercise, we wouldn't have the obesity rates that we have. You know, so I know it's a challenge, but I think really it's just gotta get back up on that horse every day and just keep getting that message out. And eventually, by that sheer repetition, you know, I think they're going to start to get it. But
I think there's a couple problems with this. If someone's in quarantine, they shouldn't be thinking, and businesses should not expect them to get a negative test and go back. I think there's a lot of people that have a quote unquote exposure that's not an actual close contact exposure. And if that's the case and it's negative and they're not having symptoms, then they don't have to quarantine. I mean, if they've had the exposure, then they need to quarantine. So that's I think the difference. But even the people that have, you know, negative tests, if they're still having symptoms, they shouldn't be going back to work. So at the beginning, I think there was a really good, you know, if you're sick, stay home. But now everybody's used that time and everybody's been out of work for their 2 weeks here, 2 weeks there because of the initial COVID stuff. So I think that some of that's why the employers are like, well, if you have a negative test, then you can come back. But I think, you know, anytime they've had a true exposure, that's a quarantine, and the health department should have called that person and told them that they're home regardless. So I'm not sure what you're talking about with the workers going back. If they have symptoms,
Well, I know.
they have a cold and they test negative 24 hours later, then we tell them they can go back. So as long as they're not still running a fever and they're feeling better, if they test negative, if they didn't have an exposure, we let them go back.
There are people that I have called Sarah about, and Sarah and I are on the same page, and those employers are not on the same page as us.
Are these considered essential worker?
No.
No.
Well, I can give you an example. I had a multiple employees call me from one particular business in town about how this business was making their employees work very ill. One person had to go lay on the floor in the manager's office because they couldn't hardly stand anymore, but the manager made her continue to work until she had a positive result. And others were very ill also.
I feel like that should be a problem. I mean, this
But
business should be reprimanded for that.
Right, I've called this person multiple times, the manager, and they keep telling me, oh no, this is what we're doing. It's corporate telling us to do this, like we are cleaning. We don't want them at work if they're ill. We don't want them at work if they become ill at work. We send them home. Like they're telling me, I think, what I want to hear. But I've talked to Nick about this business, and Nick told me I could, DIA can give them a call and say, here's the deal. We've been getting a lot of complaints about it. So yes, I know there are businesses in town that there are very ill people working at, and the employer is threatening them with their job if they do not stay at work or come in. So yes, we are calling these people and we are talking to them, and I think they're telling us what they want. They know what we want to hear, and they do the exact opposite. And the problem is, it's always after the fact that someone's tested positive, and if we walk in there, there's not an ill person in there at that point. So it is frustrating. Sure, we can keep putting out on Facebook, if you're sick, stay home. Employers, no one can test out of a quarantine. If they've had a true exposure, they have to stay home for or it's recommended, And if we use any other word besides recommended, people are screaming and yelling at us that we can't force them to do anything, or we are taking away people's rights. It's ridiculous, because in all honesty, we can put them on a mandated order, either from the Board of Health here or IDPH. So yes, we actually can mandate people. That's what they were doing at the beginning of this. Everyone who tested positive had a mandated order from IDPH. So we just get cremated here every time we put any kind of message out. If it's something they don't like, they will, if it does not meet their agenda or their view or their opinion, we are decimated over here. It's ridiculous. I can't even read Facebook pages or the comments anymore because they don't make us feel good all the time. I'm just putting that out there.
People are idiots.
Well, and I would agree with Becky on the comment about repeating the message, because that's what they're doing on the national level. They continue to repeat a false message, and then it becomes truth. It eventually becomes the truth to the public, and that's been stated on TV already. That you can continue to repeat the same message, it becomes the truth. So whether it's a positive or a negative message, it doesn't make any difference. So I can see where you're really fighting that, Sarah. I can't believe it, but.
Well, you can flat out tell somebody and they will hear what they want to hear. I mean, I read a nice little news article and I was like, oh, well, that's interesting, because that's not what was told to the person, but that's fine. I mean, they did have COVID, but whatever. But the thing is I think, I felt it was very poignant that the rec center had to send out a message that said, if you have COVID, you're not allowed to come here. It's like, what?
Yeah.
What?
And that's why we put that message out. And holy smokes, you don't tell people what to do. But I mean, it's common sense.
But we can tell people what to do.
Yeah.
Right, and they don't think we can. It drives me bonkers. Like, it literally makes me have a real crappy day. And not only me. I mean, Nikki's dealing with it. Everybody here in this office is dealing with it. Dr. Heim, you're dealing with it. Everybody I feel in healthcare is dealing with it. Everybody's sick of it. But we're still trying to do our part to keep everybody healthy and safe by so much as we can. We put out messages all the time. People are just mean. That's all I gotta say.
I feel like we have a responsibility to discipline businesses that don't follow basic recommendations. If patients, I mean, at the end of the day, I don't think you can arrest someone for going to the grocery store when they're sick.
Actually, you can if they're mandated.
Yeah, I'm talking about like, that they didn't have a positive and they just had a swab and they went. I mean, I had a positive that came in who could not come in any earlier than 6:30 because she had to go to work.
Oh,
by the way, she was
oh my
positive.
gosh.
That's
Oh my
great.
gosh.
Yeah, but I think there's a lot you can gain by the implications. I think people really feel bad about exposing other people. I honestly think that. Like, that is the only motivator I can ever give to someone when they're like, I really need to be tested? And I'm like, you probably don't have it, but if you do, and you go back to work, you're going to feel awful if you give it to everybody. And everybody agrees on that point.
Right.
Heather, do you have a comment on this at all, on this conversation?
My comments would stem around burnout and exasperation of all of our healthcare workers with trying to continually say the same message as Dr. Heim and Sarah are eloquently saying. It's something that everyone is experiencing. And frankly, I'm worried about burnout of all of our healthcare workers, but specifically those public health workers on all fronts that are making these calls and hearing the negative feedback and being screamed at and all of that. So I sense, so I try not to complain, but then don't offer a solution. One of the things that I just sent was what Iowa State has put out for their students, and it's a frequently asked question thing that they have on their website. So that might be an idea as you're looking at public health messaging, to try and maybe do a frequently asked question of the day or something. It's an idea.
Are there any repercussions to these businesses that are not complying? I mean, can we do anything there?
Yep. So I think Sarah said, I don't know what businesses you're talking about, but if it's a business that is inspected or governed by the Department of Inspections and Appeals, which would be the food industry, certainly with Nick, their EPI, they can help kind of facilitate some of that if that's the type of business that you're talking about.
And yes, it is a food establishment.
All DIA.
Yeah.
Yep.
Also, Sarah, I think you can turn commenting off on your posts on Facebook. So if you don't give people the opportunity to comment, then don't.
Oh, that's good to know. I'll let Sarah Skinner know that.
Yeah. And then also
she's doing a great job of running it.
And what about just maybe reaching out to Carroll Broadcasting, because I'm sure that they would, if anybody has a quick update or this is the point of the day, I'm sure they would make that as a news story every day and repeat it or put it on, because media partners like that, and the Carroll paper, I know Jared's been on top of all this stuff too. So it doesn't necessarily have to be just, the Facebook posts, because Facebook is toxic right now without COVID. It's horrible. So with COVID, it's just even worse. So, something like that. And I don't know, if there can be little reminder that, is there still like the cable channel, the Carroll cable, the local channels, there'd be something on there as reminders too. I don't know. Just again, it's just thinking outside the box to try to have some sanity with the situation, I guess.
So I'll just make one more comment. Sarah Schulte, you've been talking about mandating masks, having a mask mandate, and this is for Becky too. If that were something that we wanted to pursue, that would have to come from the Board of Health to the supervisors, correct? Okay, so I mean, you know, there's nothing, I guess I'm just wondering if the Board of Health and Sarah come and meet with the supervisors and say, we're on the cusp of a mask mandate, you know, and say, you know, you are involved in this. You with the Board of Health will make this call. We would just as soon not do it. We don't want to go that way. So we're urging people to use their mask. I mean, it can be just a message. You know, it doesn't have to be an ask. Does that make any sense?
Yes and no, Dean. I just don't know how much teeth without a state, you know, without this originating from Governor Reynolds, you know, the other cities and counties that have tried to do this, in my opinion, it's ceremonial. It's in name only. I don't feel like it's enforceable. And if something isn't enforceable, you know, you've just opened up to having the public health staff and then the Board of Health and then also the supervisors just give even more hate mail. You know?
Well, you're probably right.
Horrible how, you know, strongly anti-mask or anti-listening to public health a good chunk of our population is right now. And it's just really, really sad. So again, I think the way, you know, like Dr. Heim said, to appeal to, well, hey, you know, you don't have to wear a mask, but I know you'd feel bad if you infect other people. Or, yeah, you don't have to wear a mask, but geez, you know, if your kid gets it, he's not going to play football. You know, just different ways like that. Like, yeah, you don't have to wear a mask, but when your kid's sent home for online learning, you're going to have to probably take off of work. That, I think people seem to be a little bit more like it's sticking, but anything that you say, you should really wear a mask. Well, I don't have to wear a mask. Yeah, it's just.
But I agree, Becky, school's been in session 3 weeks, and now the number of kids getting sent home. I mean, I got the call, I have to admit, I wasn't very happy when I got the call, and I'm just like, gosh darn it, you know, it's like, it's not my kid, but 2 seats up and masks were mandated at Kemper, you know? And I think that we just have to work on these businesses because several of these cases are coming from the parents. So the parents positive, and then they go to Test Iowa and they get everybody tested. Because most of the kids at the school level are asymptomatic people, you know, but then they affect so many kids. And I think now that it's starting to affect more parents, more kids, my kid's out of cross country for 3 meets. I mean, it's raining, so one was canceled, but the effect is now really happening because we're 3 weeks into this. If we could really just get those businesses to take this serious, because there's multiple stories of the businesses allowing the Test Iowa, negative test, they come back. Well, they're still, they were in quarantine from Sarah, from public health, from, you know what I mean, for a reason. Wife had it, husband went and got tested. Business said husband can go back, but they're technically quarantined because of the wife. And the worker I had with the 3 students from school, the husband got it a week later after the daughter. So but you see what I mean? And he went to work when he was supposed to be quarantined because of the daughter. It's just absolutely crazy because the work said, oh, well, don't worry about it. We know your daughter's positive, but we're going to take your temp twice a day. But he turned out positive a week later after working with all of his people for a whole week. Kids can't go to school because the school nurses they're on Sarah's side and helping and keeping the list. You can't get back to school, but you can get a free pass to go back to work if Test Iowa says so.
And I'm not sure who in Test Iowa is saying that. I don't know if they mean because they had a negative result, but as we all know, a negative result doesn't get, right. They give them a piece of paper?
Well, the Test Iowa tells them they're negative. You put them into quarantine.
Oh, right.
because of the, you know what I mean, mom, dad, daughter, you put them in quarantine.
Right.
Yes, Iowa says I'm negative, my work says I can come back as long as I had a negative. I don't care what public health told you. See what I mean?
Oh, yeah, I get you. Because
So
they got that
know,
negative result.
They know. The other
Yeah.
kids are home because the school nurse won't let them come back. The school principal, they're on that list. Makes sense?
Right.
But
Right.
the worker is allowed to go back to work because that business doesn't care. Oh, duh, you got a negative test, you can come back to work.
Right. So maybe we just need to keep putting that blurb out. No one can test out of a quarantine.
But
If
if
you
we
are
don't get
asked
the
to quarantine.
businesses to buy into that, then we gotta have the businesses buy into that.
Right.
And then
And I don't know if,
businesses need to realize the ramification if we keep sending all these kids home and go hybrid, go online. Now your worker isn't gonna be able to go to work because now you're gonna go deal with your kid at home because of schooling. I don't think the businesses are seeing it like us parents right now. Because all the kids are back in school 5 days a week. That's all that these businesses are seeing is that the kids are back in school right now today, but that could change in an instant next week if we don't get a handle on these numbers.
right. So, I mean, kind of back to the masking thing. So just to let you guys know that Carroll County Public Health, along with St. Anthony, and I think McFarland is doing something like this, but we're kind of going to start a campaign for masking. So we're going to be putting something out tomorrow that pretty much says, join the Carroll County Cares campaign. We care about protecting each other. Please join your family, friends, and neighbors in sharing your masked up photo along with a positive message about why you wear your mask on your own social media. And we're going to ask people to use the hashtags like hashtag Carroll County Cares Iowa, hashtag Mask Up Iowa, because, the state is doing a Step Up Mask Up campaign, and we thought, to kind of help with that, and maybe if we kind of can move forward and tell people, why do we mask up? We mask up because I want to protect my grandma. I don't want her getting COVID. I mask up so I can watch my daughter play volleyball and my kid run cross country. So maybe if you guys start seeing that campaign come out on our public health post, if you guys would like to participate and kind of spread the word of masking up and the reason why, just to try to get some positive messaging out there about why it's important to mask up. So
what I
that's
think
what
would
public
be
health.
really helpful. Sorry, go ahead.
No, that's about it.
No, I was just gonna say it would be really helpful if there was some teeth in the wearing the mask. I really think if they could reward these students for wearing masks all day by not quarantining them, that would send a much stronger message than, well, you still have to be quarantined, so why wear a mask?
Right.
That
So,
I was going to mention that too, because I had a kid sent home today. He's only got 4 football games scheduled this year, and he's going to miss one of them next week, and it sucks. And I explained, well, they're not medical masks that you're wearing, but I know that is coming out, especially through Kemper kids that are being sent home.
Right.
So the education there as well. But with your Mask Up campaign, just wanted to make sure, are you including Manning Regional, someone from them?
I think that's why we put Carroll County Cares Iowa.
Okay. Just to make sure someone from.
Yes, we will. Yeah, because we're going to talk about it at our coalition meeting tomorrow. Okay. So I'm trying to think of anybody. I think Jill is on from Manning. So okay. Yes, she will. She'll kind of look at that too. But I could always make sure somebody, Julie or Jill, gets that too. I know that I've talked to Nick, my field FE, multiple times because I don't want to quarantine all these kids that are wearing masks and doing the right thing. And I know that Carroll, they had this face shield with that, I think it's called a shroud or something underneath of it, which it's like perfect. It's CDC approved and things like that. And yet, why are we still quarantining these kids that are wearing their masks? And I've called Nick multiple times, can you guys change this? because I feel like we're punishing them now. They're doing the right thing and now we're punishing them. So I am on board with saying if they're in a mask and it's worn correctly, they don't have to quarantine. But you know, that's why we're following IDPH, and at this point it's still, he said probably, you know, it's going to be in the works of the talks of saying, okay, if everybody has a mask on, do we really have to quarantine everyone? I think that will be in talks with IDPH, and once we get that kind of notification, I will be sending that out to nurses at the schools of our county to say, hey, it's just the people that didn't have masks on and the kid that's positive. And I know I'm for that, but we're following IDPH guidelines at this point, unfortunately.
Heather, do you know, are they, I mean, that's what we're hearing too, that IDPH is working with Department of Ed. If schools have the mandated mask, then the quarantining would be less.
I have not heard that yet. You guys probably have more information than I do. The last I knew was on the webinar when they just said they're following CDC guidelines, and that was still along with that. So if that's whatever Nick is telling you guys, he's in on that more than I am.
And I don't like to ever tell anybody that we should shift the blame to someone else, because that's not what I'm going to get at here. But I feel like in this particular case, if there's a way that maybe we get the message out that this is being followed from IDPH, so that our school nurses, so Sarah, so Nikki, so a little bit more heat can be taken off of them, because I've heard through the grapevine that some parents have been calling school and just irate over their kids being sent home, which is, you know, emotions are out of control right now. But if there's anything at all, especially, you know, since we know this is coming straight from the state, I would be okay if that messaging was out there to take a little heat. You guys have enough on your shoulders right now.
Right. Yeah, I really do just wish they'd say, if everyone, I know they're not medical, and I know all these kids are not probably wearing them correctly. And that's the hard part. And that's where this piece comes into play, is because I've seen kids with it just over their mouth. I've seen it under their chin, you know, and that's the piece that we'd really have to work with, of make sure your mask is on correctly the whole time when you're around all these people, which would hopefully then help decrease your risk of having to be quarantined. I really hope that I hope that IDPH starts moving toward that, so not 100 kids are quarantined at a time. But we'll see. They don't move the fastest all the time.
You know, Becky, and just taking a line out of that editorial from Dr. Cohen in Lucas County, I wear this mask for you, please wear a mask for me. You know, I mean, that's really what it's all about.
Mm-hmm.
And I actually wrote some, you know, I do my weekly volunteer column for the Observer. And this week I put in statistics comparing Carroll County to other counties of similar population. And I also put in, just picked one day and compared what Carroll County's numbers were, what the state of Iowa's numbers were, and what the country of Canada, the country of Germany, and the country of Australia. And it is eye-opening, because I know I hear from a lot of people, well, it's like this everywhere, right? I'm like, no, it's really not, because there's more of a trust of government and experts in other areas. We're very divided right now. So everybody thinks everybody else that doesn't think like them is stupid and doesn't know what they're talking about. So, you know, I guess things like that too, that we have to combat, that people just assume it's no big deal, the numbers that we have. And yes, it's not like our hospitals are completely overrun or we've got, you know, people dying in the streets, but what we have here is not really normal in other parts of the country and the world with our numbers right now. So the more again, we continue to help break down stereotypes and just stubbornness. But we could probably talk about this forever too.
Right.
And
Okay.
but I don't know, if anybody has anything else, or, you know, Sarah, anything, you know, that you would like from us?
Right now, I don't know, not right now at this moment. I can think of. But thank you.
So the main thing right now is focusing on education and all the flu clinics, and I know, you know, this is your first fall going through that. That is typically, we've seen high stress levels in our public health staff during flu season and with the flu clinics. And so just wanted to, you know, make sure that you have all the resources and everything that you need, without the COVID stuff on top of that. But, you know, like I said earlier, just going back to the contact tracing. Because I personally feel like our numbers are probably going to be really high tomorrow, just to make up for the days that they didn't test. We'd been trending that way every other day, over 30 cases. So if this feels like it's causing even more stress to not have that first step, you know, if you feel like state contact tracing isn't working appropriately, well, then it can be changed back. This was just an effort to try to free up a little bit more time to get more of the education, the flu clinics rolled out, because fall is our busiest time in public health. So just wanted to make sure that you guys can have a normal 40-hour work week. That would be the goal, to try to get there.
Right. Sounds like a plan.
Okay. All right. Anybody have anything else?
I'll make a motion to adjourn.
Got a second? Or Art, were you going to say something?
Yeah, I would just like to reinforce Heather's comments before, her concern about burnout in public health and the nursing, all health professionals. I think we gotta just relay to Sarah that a lot of the negative comments, she shouldn't really, hopefully, take those personally. I think it's frustration with the disease, not them, you know, and that's a hard thing to you know, distance yourself from them a bit. But, you know, I am concerned about burnout with all the health staff. I think that we got to be concerned about that. And then the other point I would make is, you know, a mandatory mask issue. We just went up to Northeast Iowa, up to Decorah last weekend to see some kids. And Decorah has implemented a mandatory mask issue in the city of Decorah. And just reading the local newspaper up there, the Board of Supervisors got a lot of nasty letters on that. Also, there's a big fight between the Decorah City Police and the county sheriff. Sheriff is not going to enforce it, so it's left up to the city police to do it. So, you know, mandatory mask issue could be big hornet's nest to open up, just because of a lot of those. You know, it's one thing to have it; it's another thing to enforce how they're going to enforce it as well. So,
Right.
Agreed.
Okay. Well, I guess with that, Dean had made a motion to adjourn, and I'll go ahead and second it. So all in favor of adjourning? Aye.
Aye.
all right.
All right. Well,
Stay safe, everyone.
Yep.
yeah.